Hi Anna, my name is Graham Hutchinson. I just want to thank you for you setting up this platform so people like me can speak about our feelings about what's going on with COVID-19. A little bit about myself. I don't really like talking about myself, but who does? I was one of the senior chief biomedical scientists at the Central Public Health Laboratory at Colindale. I worked in the Division of Hospital and Respiratory Infection and Antimicrobial Reference Unit. We were responsible for the day-to-day monitoring of outbreaks of infection throughout the country. I was responsible for the running of the MRSA reference unit, the gram-negative unit, the molecular PCR typing unit, the identification unit, hospital hygiene unit, and other various laboratories within our division. I was also personally responsible for the global reference service for the category 3 organisms, Francisella tularensis and Burkholderia pseudomallei. I know people like to verify who people are. Whilst there, I worked with Professors Hodgson and Geddes at the Royal Brompton Hospital, doing research on home-use nebulizers of cystic fibrosis patients and Burkholderia cepacia, a lethal pathogen for them, there being a primary source thereof, and you can Google that. I also worked with Professor Nolan of New Zealand on the effect of Manuka honey being bactericidal against MRSA strains, vancomycin-resistant enterococci and other organisms. And various other works I did there. Before that, I was the chief biomedical scientist at the Royal Brompton Hospital, responsible for the day-to-day running of the microbiology department, bacteriology, tuberculosis laboratory, parasitology, media, that kind of stuff. And again, if someone wanted to verify, I did a paper with Chadwick and Geyer on temocillin activity against Haemophilus influenzae. This is only going to be a short video. I don't think there's any use these days of videos going on but on 5 or 10 minutes at most. So I'm going to keep this very short and just concentrate on 3 areas which I think are currently being missed. The first one and most important, I would say, is virus attenuation. When vaccines are produced, they are passed through cell lines, and they go from cell line to cell line to cell line, passaging. And as the virus passages, it gradually gets weaker and weaker and weaker until it is to such a stage that it can be used as a live vaccine. Back in April, Armengard et al. Had already noted that there was what they termed as viral drift amongst the genomes where the COVID-19 was changing. And Yeo et al. Were showing that there were changes in the spike of the virus in regards to pathogenicity. He also said that because most of the strains that have been submitted for genome analysis were from highly dangerous cases and people that were heavily infected, that there was probably even more viral drift because they weren't looking at genomes from mild cases. So that's the first thing that I think really needs to look at. We're seeing a lot more cases and a lot less deaths all over the world, and in my view COVID-19 is not the same organism as it was when it was first isolated and has now very low pathogenicity. I would recommend everybody to go and look at a website called nextstrain.org, nextstrain.org, and just look at the numbers of genomes and what's going on. There are thousands and thousands now of different strains of COVID-19. So when someone says COVID-19 as a virus, it's not. It is now a huge family of viruses derived from the first Wuhan strain. And when you think about it, bats carry the organism normally. They're not killed by the virus. What point is there to a species if it kills its host? So I believe we're now seeing a less virulent but more contagious virus that is spreading everywhere. The next thing I'd like to talk about is influenza vaccine. Cowling et al. Did a study where they showed that those who were given influenza vaccination were significantly more likely to develop other non-influenza respiratory infections after getting the influenza vaccination. Currently, we're seeing in South Korea there have been 83 deaths following influenza vaccination, mostly in elderly people, and Singapore have actually stopped giving influenza vaccination. There were so few cases in the Southern Hemisphere this year that the World Health Organization literally had to guess what strains to put in the vaccine for the Northern Hemisphere. So I think there should be a watch or a warning, an alert going on where if anyone does fall sick following flu vaccination, this should be flagged very urgently. The last thing I want to talk about, and in a way connected, is masks. There's a Danish study which we're all waiting to be published, which I'm sure is going to show that masks are useless. There was a study by McIntyre where he did a randomised controlled trial on 1,600 healthcare workers and found that those with cloth masks were more likely to be infected with the influenza virus than those with no masks. So let me just say that again, that those with cloth masks were more likely to get influenza infection than those with no masks. And influenza virus is actually larger than COVID-19. There was also a South Korean study which was very quickly retracted, where they took 4 heavily infected patients with COVID-19 and got them to cough with various masks and no masks. And they found that COVID-19 went through the masks. And not only that, the virus actually aggregated on the outside of the mask. So all this touching of masks when people are out shopping and touching things is actually more dangerous than no masks. And the aggregation on the outside has been shown by other studies too. So that brings me to a connection between the influenza and masks, because if we are seeing influenza disappearing throughout the world, yet we know that masks are not effective in stopping influenza, then where have the cases gone? My view is that there is some severe misdiagnosis going on, and once again this PCR test needs to be looked at. So those are my 3 areas. I'll just go through them again. It's virus attenuation. I think we're now looking at a low pathogenic strain compared to the original strain. Masks are not working, and flu vaccination is something that we should be aware of. So I hope people can do some research on these and try and make these more in the public domain. So again, thanks once again for giving this opportunity, and I totally endorse everything that Dr. Mike Yaden has been saying. It's crazy times, and sadly we've lost the science somewhere. Okay, thanks. Bye bye.